Does diabetes type 2 require insulin? Essential facts about modern treatment approaches. Type 2 diabetes affects millions of people worldwide, changing how their bodies process sugar and use insulin. Many people wonder if insulin shots are always needed to manage this condition. While not everyone with type 2 diabetes needs insulin therapy right away, about half of all patients will eventually require insulin to maintain healthy blood sugar levels. The need for insulin often depends on factors like how long someone has had diabetes, their lifestyle habits, and how well other treatments work. Treatment options for type 2 diabetes have expanded beyond just insulin. Many people start with oral medications, diet changes, and exercise before moving to insulin therapy. These choices help doctors create personalized treatment plans for each patient. Type 2 diabetes treatment starts with lifestyle changes and oral medications before insulin becomes necessary. Most patients will need insulin therapy as their condition progresses over time. Modern insulin delivery methods and treatment options make diabetes management more flexible and convenient. Type 2 diabetes is a serious metabolic condition where the body does not use insulin correctly. Insulin is a hormone that helps move sugar from blood into cells for energy. In people with type 2 diabetes, the body either doesn't make enough insulin or has become resistant to insulin's effects. Progressive deterioration of beta cells in the pancreas leads to reduced insulin production over time. Key characteristics of type 2 diabetes. Many people develop type 2 diabetes due to lifestyle factors and genetics. Many people with type 2 diabetes need insulin therapy to control their blood sugar. Research shows that most patients with type 2 diabetes will eventually require insulin to reach their treatment goals. Insulin helps cells absorb glucose from the blood. When the body doesn't make enough insulin or can't use it properly, blood sugar levels rise. Early insulin treatment can help preserve beta cell function in the pancreas. Starting insulin at the right time may help maintain the body's ability to produce some of its own insulin. Some patients start with oral medications first. The amount and type of insulin needed varies for each person. Understanding type 2 diabetes treatment options. Treatment options for type 2 diabetes have grown more advanced over time. Many patients can manage their blood sugar through diet, exercise, and oral medications in the early stages. As type 2 diabetes progresses, many patients will need insulin therapy to control their blood glucose levels. Modern insulin delivery methods like insulin pens make treatment easier for patients compared to traditional syringes. Healthcare providers work with each patient to find the right combination of treatments. Blood sugar monitoring plays a key role in treatment success. Patients need to check their levels regularly and adjust their medication as directed by their doctor. New therapeutic options continue to emerge for type 2 diabetes. These give doctors and patients more choices to create effective treatment plans that fit individual needs. The need for insulin varies among patients. Some people with type 2 diabetes never need insulin, while others require it within a few years of diagnosis. Factors influencing insulin use in type 2 diabetes. Several key factors affect whether someone with type 2 diabetes needs insulin therapy. These factors include blood sugar levels, how well other medications work, and the body's response to treatment. When patients understand their treatment goals, they are more likely to accept and stick with insulin therapy. Treatment barriers can make it harder for some people to use insulin. Some people may need to start insulin therapy sooner if their blood sugar remains high despite taking other diabetes medications. Type 2 diabetes is a progressive illness, which means treatment needs often change over time. Regular exercise and healthy eating habits may help reduce the amount of insulin needed to control blood sugar levels. These practical factors can determine which insulin types are available to patients. Many people with type 2 diabetes start treatment with oral medications like metformin. These medications help control blood sugar in different ways, such as improving insulin sensitivity or reducing glucose production. When oral medications alone don't work well enough, doctors may add insulin to the treatment plan.